House Bill 3260 is a continuation of Oregon's bold leadership in healthcare. For the past 20 years, both public and private entities have conducted at least 27 economic studies comparing single-payer financing to other healthcare delivery methods in the United States. However, none of these address unique concerns of our state.
Payer option, it would look at a public option competing with private plans. It would look at the status quo, the Affordable Care Act, with the Cover Oregon exchange that is going to be coming into effect next year. And a fourth option, which you don't have on the bill, it will be part of an amendment that has been drafted, would have the people doing the study look at a proposal that some of you might remember came to the legislature in 2011. John DiLorenzo was the sponsor of it. It was in Senate Bill 972, which would separate health care coverage from employment and would fund universal health care through a dedicated sales tax. So this study would look at that as well.
Work session, what's going on, what happened today?
All right, this was a successful hearing. It was short, sweet, painless. Nobody on that committee is going to have a problem voting in favor of this. Representative Dembro read down the list of the very credible, impartial, neutral, respectable adult organizations that have sent in written testimony for this bill.
Such as the Oregon Medical Association and OHSU.
On the House, at the moment, there's no organized opposition to this bill.
I'm here today at the Capitol in Salem with Mike Huntington from Mid-Valley Healthcare. Mike, would you please share with us the results of the day?
Yes, we are very pleased with the results today of the hearing for House Bill 3260, which is a bill that would fund a study of a variety of healthcare financing systems, including single payer, but comparing that to what we have today, which is the Affordable Care Act, the federal bill, and coordinated care organizations. That would be one other option. A third option would be a public option versus private. You could have either one. And a fourth option, which may come as an amendment, is a sales tax dedicated to universal health care that would be separate from employment status.
My close-up.
And you'll do that after.
I'm here at the Capitol today in Salem with Bud Laurent from Mid-Valley Healthcare. Bud, would you share with us the results of the day?
Well, today was the hearing at the Healthcare Committee for the state legislature on a bill entitled HB 3260, authored by Mike Dembro and supported by a good number of representatives in Oregon, including our own Sarah Gelser. And the purpose of the bill is to establish a study that would examine at least 4 different options for health care in Oregon, including a universal publicly funded system, aka single payer. And the committee didn't vote on it because an amendment has to be worked on yet on Monday at the work session, but it's our impression that there seems to be pretty good support for the bill. One of the things that shouldn't be an objection to anybody is that the funding is not public. It is going to come from private sources.